question because it's almost impossible to measure. It's like looking for a needle in a haystack. Paano mo ma-isolate when both PhilHealth and HFEP are moving in the same direction? And I searched for the literature and there's nothing that could guide us on how do you measure the impact of social health insurance and how do you measure the impact of capital investments. The other thing I want to say in that regard is, and this is an even more serious criticism, it may be a function of secular trend. Your economy is growing, households are becoming richer. It's just sheer secular trend, right? So where do we get the definitive conclusion that it is due to one factor over another? We can't. We can't. It's impossible. But as a researcher, I am already very satisfied that the direction, the trend is going in the right direction, right? At least for hospitals, strongly shown in hospitals. Because that to me indicates that we are not doing the wrong thing. That the utilization is increasing. Imagine what would have happened if we saw a decline in utilizations, like, oh my God, stop that project. So at least I don't. Imagine if you're showing a chart in Congress with falling utilization rates. So I'm not overly worried about attribution at this stage. I mean, I can defend this study in Congress and say, put more money into HFEP because we are just replacing old capacity. We are not dramatically increasing new capacity. We are just replacing old capacity, and the population is booming at a rate of, what, 1.7 million a year? What we need to check are the implementation issues. Those are my comments in that, on that issue. The second thing is with respect to accreditation. And we have already noted that, and I have cried about this issue for as many years as I can remember, because this issue is most acute in the case of TB-DOTS. TB-DOTS accreditation is very, very slow in PhilHealth because it's very difficult for them to get together, PhilHealth, the National Tuberculosis Program, and PhilCat together to visit a TB-DOTS center. So as of now, I think only 50% of the licensed National TB Program, TB-DOTS providers have received their accreditation from PhilHealth. And believe me, because I've visited some of them, there is no difference between an accredited and an unaccredited TB-DOTS provider, except for this paper thing. So our suggestion has always been, why doesn't PhilHealth just get rid of the accreditation and pay all the licensed DOH, TB-DOTS, birthing centers, and animal bite clinics, and ano ba yung isa? OPB. There is no point in accrediting because they are licensed by the DOH anyway. And my suggestion, our suggestion, is why don't you just convert the accreditation into monitoring? Put more focus on monitoring those primary care providers and TB-DOTS and MCPs rather than put a major obstacle called accreditation. In other words, let the money move and then give them a schedule of, okay, you are deficient in one or two things, but since I am keeping the money flowing to you, you should be able to address those problems, right? So that's my approach of all these things. There is really no sense in PhilHealth holding up the flow of money to these public health providers using accreditation as a tool. Number 3 has to do with, we need to be measuring quality, right? Instead of utilization. I learned belatedly that indeed we need to be measuring quality. The only problem is, if you review the literature and quality, while quality runs the gamut from structure or input to process to outcome. So which do you focus on? This, and there is no accepted, tell me if I'm wrong because I've searched and searched and searched, there is no accepted list of quality standards that provides you perfect specificity and epidemiology with, because you need to sensitivity and specificity, because you think it's easy to choose the indicators? No, because of these two things in epidemiology, those of you who studied epidemiology. And until now, we don't have a list from DOH on which quality aspect should be measuring, unless someone can tell me this 4 or 5 or 6 things. Is it the infection rate? Can you trust the infection rate? Is it the death rate? Can you trust the death rate? Is it the way they get rid of their medical waste? Can you trust that? So which, is it the way that the toilet smells? So whose nose are we going to use? So it's easy to think of quality conceptually, but it's very difficult to apply it in empirical terms. So that's my number one issue with quality. That is why we chose the simplest measure, which is just utilization. That's how we derive utilization as the indicator to use. I think that's my last point on Dr. Dairit's, our lack of good track record in infrastructure. It may also give a little consolation to you that it is not just the Philippines that lacks a good track record in infrastructure. It's almost all emerging economies. I work in IDA economies in Africa. It's very, very bad. It is just the advanced countries that have a good track record in infrastructure. So that should that give us at least some relief? So I'm an optimistic person, so I'd rather say, okay, we have a bad track record. Until now we have a bad track record. We should get together and see what are the bad things and how can we improve them. And my number one suggestion is maybe we should have a manual on how to commission capital projects, because I haven't seen a DOH manual. If you look at the US manual of DHHS on the commissioning of health and other social services, it's probably this thick because it's so many volumes. And we haven't started the practice of developing manuals